Okay, so I am really honored to be able to introduce one of the country's best-known physicians, Dr. Joel Fuhrman, and probably don't really need too much introduction for most of you. He's a board-certified family physician. He's a New York Times best-selling author, a book, Eat to Live.
5 books.
Well,
oh, I'm loud. Wow, that is loud.
But Eat to Live was on the New York Times bestseller list for like 90 weeks or something like that. That's just amazing, over a year. That's very, very cool. A nutritional researcher, and he's been a featured expert on many radio and television shows. If you've seen more recently, he's just got a new PBS special that's out that's called In Dieting Forever. And one of the things that I think is just really exciting, being a PBS fan myself, he's raised over his programs and stuff have helped raise $30 million for PBS. Not only to raise money for PBS, but to make a huge difference in the world. I mean, he's constantly running into people who have watched some of these presentations and just seen life-transforming experiences as a result of that. So a real blessing. He received his medical degree from the University of Pennsylvania, but before entering the world of medicine and nutrition, he gained national and international recognition for something very different. Anybody know what that was? Ice skating, yes. I don't know too many physicians who have that part of their CV, but I think that's pretty exciting. And you'll notice that he has more active kind of shoe wear than just dress fancy stuff going on here. So he came running in here. So anyways, yeah, he's been second and third place awards in both US and national pairs championships and all that. So some pretty high level experience in the world of figure skating. I love to watch figure skating, but Dr. Fuhrman, I'm very pleased that your life path took you a little different direction, because your amazing work has blessed millions. And we would like to welcome you to Portland, and we look forward to your presentation, Combating Obesity and Treating Disease with a High Nutrient Dense Diet. Thank you so much.
Thank you. Thank you. Well, I'm really excited to be here and to talk to you today. And I would like to I'd like to finish all the slides and present all the information if we have time, and leave time for some questions if we could. So I want to get it done as quick as we can so we can interact and take a few questions. And I'd love to spend hours and hours with you guys and just give you as much information I can and tell you my experiences, how much fun this is and what I've seen. But I'm going to try to just give you some highlights and what I think is important at this point in the history of nutritional science. And I am going to talk rapidly because of the audience, and I think that certainly raise your hand if I'm going too quickly or I went over too fast and I need to slow down a little bit. Please, stop me or ask me to repeat something, okay? So let's get started so I can go through as much of this as possible. What I'm going to go through today is what's a Nutritarian diet and maximizing its design and effectiveness for disease reversal. And obviously, if a person's going to have 100% occlusion of a major coronary artery and open it up completely and get well again, they're not going to do it unless they drop tremendous amounts of weight and their body fat becomes very low. They're not going to get rid of their diabetes and become non-diabetic, which is defined as a person with a fasting blood glucose below 100 and with no need for medication, unless they get their body fat, both the subcutaneous fat and the visceral fat, very low. So obviously this is very effective for weight loss as it reverses disease, and you can't separate losing weight from the therapeutic disease effects. So obviously it's about weight loss as well, but I'm highlighting its therapeutic efficacy for various diseases and how I adjust the protocol for those diseases. And then we'll go through some case histories and some potential problems I've experienced over my 25 years of medical practice in this field with low-fat vegan diets, the problems people can get into and how you can solve those problems, and what nutritional deficiencies or issues might arise, and the conservative use of nutritional supplements to prevent and treat depression and prevent later life dementia. So we'll touch on that also. So first I want to define what is a Nutritarian diet. I want everybody here to be able to explain what is this type of diet style that Dr. Fuhrman recommends. What are its primary principles? What does he expect people to eat or not eat? And how do you define it? And I want you to be able to really understand it completely. So let me go over that quickly. It's based on 3 basic principles. And the first principle is that the diet has a high micronutrient density. And that means that when I say a high micronutrient density, I'm talking about a lot of phytochemicals and antioxidants, a lot of micronutrients per caloric buck, but also I want it to have comprehensive micronutrient adequacy, CMA, not be missing anything a person might need. You could be eating a ton of kale and broccoli and still be low in vitamin D or B12 or iodine, for example. So we're talking about high micronutrient density and comprehensive micronutrient adequacy as well. So and the American diet is the opposite of a Nutritarian diet because it's focused on about 60% of calories come from processed foods like pasta, white bread, salad oil, mayonnaise, donuts, cookies, crackers, rice cakes, breakfast bars, chips. It's going a little faster than I can slow it down. And those foods, as most people know, have no significant micronutrient load. There's no significant vitamins, minerals, and no phytochemicals and antioxidants in processed foods. Almost none, though they're mostly plant-derived. And then you have about 27% of calories now from animal products. And animal products do not contain any antioxidants or phytochemicals, those micronutrients whose predominant role is to prevent cancer and stabilize the genome and the cell structure. And yes, micronutrients have the ability to arm the NRF2 transcription proteins, which activate the ARE, the antioxidant response element in the cells that repair broken DNA cross-links and remove methylation defects that eventually accumulate and lead to cancer. So the body's ability to fight cancer is totally dependent on the consumption of these foods that are high in phytochemicals. And one of the chief phytochemicals I'd like everybody to learn about today is called ITC, an abbreviation ITC, which stands for isothiocyanates, that are found in green cruciferous vegetables. Because the ITCs in green cruciferous vegetables fuel the development of the interstitial lymphocytes that line the digestive tract. They fuel the development of the bone marrow's development of natural killer T cells. They fuel the development of the body's anti-cancer ability to detoxify and repair broken DNA cross-links, remove free radicals. In other words, they're very critical. You could say without green vegetables, you can't have a normal functioning immune system. You can't be normal. You can't be expected to be a normal human with all its lifespan and health potential unless you eat green vegetables. That's where the money's at. So, as you can see, I say a piece of chicken is just like a bagel. It's the same thing. Well, why do I say a piece of chicken's like a bagel? Somebody, please help me. Right, because neither one has a significant micronutrient load. They're just a source of macronutrients. They contain calories, macronutrients, fat, carbohydrate, and protein, but no significant micronutrient load, especially antioxidants and phytochemicals. But there's another reason why you may not be aware of, and another principle of a Nutritarian diet where a piece of chicken is like a bagel too, and that is, I not only want the diet style to be micronutrient favorable, but I also want it to be hormonally favorable. You can understand that. I don't, because we eat a diet, let's say, with a high glycemic effect. It's going to push up insulin secretion. And a heightened level of insulin is a growth-promoting hormone. It encourages the storage of fat. It promotes cellular replication. High levels of insulin associated with high rates of cancer. Insulin promotes angiogenesis. I say in my PBS television show that angiogenesis is not the first book of the Bible, as some of you may think. It means the promotion of the new growth of blood vessels to fuel the fat supply. In other words, to grow fat on the body successfully, the fat cells secrete pro-angiogenesis hormones to help the blood vessels grow into the fat supply, to feed it with oxygen and calories and glucose to stabilize its growth. And the same pro-angiogenesis hormones are secreted by cells that become precancerous and eventually turn into cancers. Metastases and swelling on cancers don't grow unless there are angiogenesis promoters allowing its growth. But these healthy foods, like mushrooms, onions, and beans and berries, have anti-angiogenesis nutrients in them that say, no way, Jose, I'm not letting you put fat on your body, and I'm not letting you spread cancer and promote cancer. They have anti-cancer effects. And insulin is a pro-cancer effect. And the other hormone we have to be careful of is IGF-1, insulin-like growth factor 1, or IGF-1, which is one of the hormones most closely linked to high rates of cancer. It's well established in many different meta-analyses that as IGF-1 levels go up in a nation or a population, we see higher rates of common cancers, especially breast cancer. Not controversial at all. And that IGF-1 accelerates aging of the brain and aging in general. And when we take animals and feed them less calories, one of the mechanisms which scientists recognize they can live longer is through keeping their IGF-1 low. They put the humans in the biosphere years ago. They fed them 30% less calories, and their IGF-1s didn't go down. And they thought, what, are humans different than other animals? We take their calories away and IGF-1 doesn't go down? But we realized that animal protein or complete biological proteins are such a powerful effect on keeping IGF-1 elevated that if you restrict calories without cutting back on animal protein, you don't see IGF-1 drop. In other words, it's the opposite of what we learned in grade school when we were kids. We learned that the higher biological proteins from animal products were favorable because of their higher biological value. And now we've learned the opposite is true, that the plant proteins are more favorable because they have a lower biological value. And because they have a lower biological value, they don't promote higher levels of IGF-1 secretion. And in those studies, we're finding that, for example, vegans run an IGF-1 usually below 150, whereas long-distance runners might run between 175 and 200, and the conventional average Americans run between 225 and 275 on levels of IGF-1. So let's go. So here, I'm saying that a piece of chicken is like a bagel because the bagel, made of white flour, is very high glycemic, enters your blood as if you're sucking on a sugar cube, and spikes a level of insulin, which is carcinogenic, cancer promoting. And the chicken has the high biological protein, spikes IGF-1, and IGF-1 is also cancer promoting. They both have sources of macronutrients. They're both deficient in micronutrients, and that I always say we couldn't have designed a diet style with less than 5% of calories from high nutrient produce. And I say 5% because it says 10% there. I'm saying 5% because half of that is French fries. Half of that 10% is white potato and ketchup. When you take that out, it's less than 5%. So the really colorful plant foods are less than 5% of the American diet. And we couldn't do a better job of getting the best nutritional scientists in the world together to design a diet like this unless, when I always say it's designed by Al-Qaeda. They wouldn't let me say that joke on PBS. They stopped me from saying the joke, and I had to change it. Then I had to say it was designed by Darth Vader. I'm saying, Darth Vader? That's not even funny. Who am I offending? Am I worried about offending Al-Qaeda? And then they took out the joke about Cookie Monster. They cut that out of the show. I couldn't say, I met Cookie Monster backstage, we became great friends, and now he's changing his name to Veggie Monster. They wouldn't let me mess with Cookie Monster. They wouldn't let me say anything about Cookie Monster. That was a no-no. So here's the point, is that we're eating a terrible diet in America, and obviously we see the results. A nation riddled and burdened with diseases of not just obesity, but 40% of the population dies of heart attacks and strokes, about 30% of these cancers. People wind up in nursing homes. They have the worst healthy life expectancy of almost all modern countries in the world is right here in this country. I'm not saying other countries are that great, but the word healthy life expectancy as defined by the World Health Organization are the parameters of living, whether you can take care of yourself, whether you're mobile, whether you're in pain, whether you're having uncomfortable surgeries, whether you're depressed, whether you have your full mental faculties. All those parameters stink in this country. Your last 10 years of life are pretty much not very well in this country. And of course, I'm saying almost all Americans are micronutrient insufficient and leading to DNA decay, mitochondrial damage, and telomere decay, the signs of premature aging. So my basic principle of health and longevity is to maximize your healthy life expectancy and the quality of your life. You want to eat a diet with a high micronutrient per calorie density, and to do that, you have to look for, seek out, and eat foods and chew them well. Eat foods that give you micronutrients. So what foods give you micronutrients? So I just took 36 different nutritional parameters that the government keeps track of. I couldn't make up ones we didn't have good records on. I had to use every one that the USDA and the FDA scores in foods, in the foods that have scores. And I added up all these 36 different parameters per same amount of calories, and I got a number, divided it, normalized it to a 0 to 1,000 score based on 100 calories of food. So people could just have a cheat sheet. not the critical basis of this program, but a tool, one tool that's useful to people to encourage them to eat more of colorful vegetables, because they can see that green vegetables don't just have twice as much nutrients as potato chips and bread and chicken breast and oatmeal, but they've got like 50 times the nutrients, right? 50 times the nutrient levels. And of course, which underrepresents the difference in micronutrient density, because we don't keep track of all those thousands of different phytochemicals that have been newly discovered. We're finding out that all the different polyphenols in berries and all the different compounds in beans, that this doesn't even represent most of those newer nutrients we're talking about. So if anything, it underrepresents the differences. The purpose of this is not to say that almonds are better than a cashew, and this kind of meat's better than that kind of meat. The purpose of this is really to tell people, I want you to eat more of these high micronutrient foods, and especially greens. It's not the whole story. There are lots of foods that are moderate in micronutrients, like mushrooms or onions or sesame seeds or flax seeds, that have individual phytochemicals with profound anti-cancer effects that we have to recognize differently, that isn't represented adequately in this scoring system either. So it's not a perfect tool, it's just a tool. It's got flaws. Like, have you heard of that study where, just to jump ahead for a minute, where they took women with a diagnosis of breast cancer, and it was a blinded controlled study where they gave half of them a muffin with flax seeds in the muffin, and the other half got a muffin that looked the same without the flax seeds. And they re-biopsied their breast tumors and found that they had significant apoptosis and regression of cellular proliferation and tumor differentiation in the group having the flaxseed muffin. So then they followed the women for 10 years, a different group for 10 years, who all with a diagnosis of breast cancer, and they tracked the amount of lignans they ate. Lignans are found in flax seeds and chia seeds and sesame seeds and broccoli stems and things like that, but it's mostly, they're very rich source of them is ground flax seeds. Ground flax seeds have about 7 milligrams of lignans per teaspoon. That's 21 milligrams per tablespoon. And the highest quartile of lignan consumption in this study was 1/3 of a milligram, 0.3 milligrams of lignin in the highest quartile. And those women followed for 10 years had a 71 decreased risk of breast cancer death from eating 1/3 of a milligram of lignin compared to no lignans. Did you follow that? Now, of course, the ability of a nutritional intervention to reduce risk of cancer or death from cancer or increase morbidity and mortality has to do with the earlier in life you start it, the more effective it is. Because as the cancer or any disease advances, the chance to reverse it becomes, it expands. There's a lot of different reasons we can talk about, I don't have time for now. But the biggest chance for the body to protect itself against dysplasia and carcinogenic changes is earlier in life, before the disease advances itself. So the fact that they had a 71 decreased mortality is remarkable, and the women were only eating 1/3 of a milligram of lignan. What if they ate a reasonable dose of lignan, like 10 milligrams of lignans a day, not 1/3 of a milligram? And what if we got them to do it before they even got a diagnosis of cancer? And that's just one food. That's just one of the many superfoods we're talking about. If I can show you studies on it, which we don't have time for today, but on every one of those G-bombs, greens, beans, onions, mushrooms, berries, seeds, I can show you every one of those foods have between a 60 and 80% reduction of cancer when people eat it in the highest quartile of consumption. But we put it all together, and when they work synergistically, and I'm suggesting that we have a tremendous power to influence obviously our population's risk of cancer with nutritional excellence. So I'm advocating, obviously, people eat high on the nutrient density line, right? Eat high on the nutrient density line. Eat more green vegetables, eat more squashes and berries and beans, and eat less animal products and processed foods and oils and sweets, obviously. And then we're talking about insulin-like growth factor 1, that a lower level extends lifespan, and how sensitive this is to sugar, but mostly to animal protein. And the question is, at what level of animal protein consumption do we see IGF-1 start to spike up? What level is it kind of like pitter-patter along at? Like, for example, in Korea, they had 1/10 the breast cancer rates we had in this country in the 1970s, and now they have 1/2 the breast cancer rates. From 1/10, that means their cancer rates in Korea went up 500% in that period. And what did they do differently in their diet? Well, they went from 6% of calories from animal products to 16%, still half what we have in America, right? But their sugar consumption doubled, their oil consumption went up by 4-fold. They changed their diet, even though they still always ate a lot of white rice. But it seemed like the effect on the insulin-promoting effect of the white rice was magnified, intensified, when they started putting enough animal protein in their diet because insulin and IGF-1 have a negative effect when you mix them together, especially like if you do, like for example, a hamburger, macaroni and cheese, sandwiches. The point is that we've got it down to a science in America. Right, a science how to kill people. We just mix the high glycemic foods with the high IGF-1 promoting foods. I always say that the food manufacturers did a wonderful job at testing this out with lab rats to make them addicted to the food, how to add the salt. Now, they don't put the salt on the French fries. They inject the salt in the French fries so you can't taste it. They don't just put sugar on, they put actually sugar in the burger meat, inside the meat. They've got it down to a science, and they test it out on rats. How do you make the rats become obese? How do you make the rats want to eat more? You put salt in the Coca-Cola. They got it all figured out, but now we don't even need the rats anymore. You got it. Okay. So, just to review the glycemic load in chronic disease, most of you guys know this stuff. The point is, it's not just obesity, heart disease, and diabetes, it's cancer. High glycemic, and the high glycemic foods are more cancer promoting in people that are more insulin resistant. Let me say that one more time. That white potato is a high glycemic food, and its studies link white potato consumption to higher rates of colon cancer in overweight women, not in normal weight women, because its effect on promoting insulin is so much more powerful, and the more insulin resistant you are, the more your body secretes a larger insulin load in response to a high glycemic food. Did you follow that? So here's glycemic load in cancer. We're talking about meta-analysis showing increased risk of breast cancer, white rice in breast cancer, 19% increase in risk of breast cancer for every 100 grams a day. That's about 400 calories. And white or black rice has the opposite effect because the low glycemic effect is about 15 points lower. From a 20 glycemic load to what goes down to a 7 if you switch from white rice to black rice. And here's where people say that, that saturated fat. Remember here in the newspaper, the New York Times, eat all the meat and butter you want. Saturated fat is no longer bad for you. Remember I heard that on the unbelievable. It's like it's worse than the blind leading the blind. But anyway, the studies showed nothing of that meat or butter was good. It didn't show anything like that. It just showed 3 things. Number one, when people switch from a diet that has a lot of animal products into it and eat lower fat animal products from more egg whites and white meat chicken and other meats with the fat cut off, their heart attack rates don't go down a lot because they're still eating a lot of animal products. They didn't eat more beans and nuts. They ate lower fat contents in meat. Number 2, they reduced their calories from fat, and in the group where the rates of heart disease didn't go down, they had higher intake of high glycemic carbohydrates. So this slide just shows you that with a low glycemic carbohydrates, we saw the heart attack rates go down when they reduced saturated fat. When they gave high glycemic carbohydrates, like white bread, white rice, and sugar, then the heart attack rate went up. So that what the study should have said was that high glycemic carbohydrates, like white rice and white bread and sugar, are just as heart disease and cancer promoting as eating foods high saturated fat. And in these particular meta-analysis, it came out even worse. All the quartiles in the studies and in the meta-analysis had high rates of heart attack, had high rates of, right, they weren't, not one was a healthy population. You don't buy a car by comparing it to a junkyard wreck. That was like a semi-joke. I'll raise my hand if I want you to laugh. So here's the glycemic loads chart, which just shows white potato, white rice, white potato, chocolate cake, corn, sweet potato. But you can see what the point is here is that almost all natural foods are below 15. There's almost no plants that have a high glycemic effect. Even white potato isn't such a natural food. It's genetically been bred for hundreds of years to make it much more fluffier and to be able to make French fries and mashed potato. The traditional potatoes that were developed in the Andes hundreds of years ago were colorful and thin and tougher to eat and didn't have a high glycemic effect. So we're really talking about that natural foods are not very high glycemic unless you process them, is the point. And here's, eat more greens and beans. Well, let's look at beans for a minute, because when we're talking about the glycemic effect, we know that the glycemic effect of beans is very, very low. But beans have the more resistant starch than any other food. There's two types of starches, carbohydrates in beans. One is slowly digestible starches, because the carbohydrates in beans are absorbed over a period of 2 to 4 hours instead of 2 to 4 minutes. Have a tablespoon of oil, it goes into your bloodstream within 3 to 5 minutes. You got that? What does your body do with something with 400 calories in your bloodstream in 3 to 5 minutes? It can't process it for energy. You're only burning 50 calories an hour just sitting here listening to me. It has to store it as fat. Right? It has to produce fat storage hormones. It secretes all these hormones to make you fit, right? But when you take in nutrients like beans, it's absorbed over many, many hours, but a portion of that carbohydrate isn't even broken down to carbohydrate. It's resistant starch, which means it's resistant to enzymatic degradation by the pancreatic enzyme, so it has to be degraded by the bacteria in the digestive tract. Now, it's degraded by bacteria in the digestive tract. They turn it into short-chain fatty acids. They turn the carbohydrate into fat, but 90% of those calories pass through you into the toilet bowl, because by the time they turn it into absorbable calories, it's down into your large intestines already. It's past the point where it could be absorbed. The 10% that are absorbed have anti-inflammatory effects that slow the absorption of glucose, and the bacteria, those beans grow in the gut. They're a prebiotic, forcing the growth of certain types of bacteria. Talking too fast? Oh, I'm sorry. I thought you got... I know I'm going fast, but I figured you guys are a highly educated group. I'll slow it down a bit. Thank you. I just wanted to get a lot of information. I only had an hour, so I doubled up the rate. You know, ever listen to those old radios? You put them on 78 instead of 33 and just play them. You say, I got the song on 78 RPMs. Okay. All right. So we're saying here that when you eat certain foods, especially raw green vegetables and cooked beans and mushrooms, they promote the growth. You have a different bacterial flora in your digestive tract than had you eaten a more Americanized diet, right? And the bean bacteria in particular, which actually breaks down and digests beans, eventually with time you stop producing so much gas, not as much fun, but you're digesting them better. But in the process, those bacteria are producing propionate and other nutrients and factors that slow the absorption of glucose, not from the beans, but from the other foods you eat. Like you eat a piece of fruit, and the glucose, instead of being absorbed in 25 minutes, will now be absorbed in 45 minutes because you have those bacteria in the digestive tract that slows the absorption because you have beans in your diet on a regular basis. It's called the second meal effect. You heard of that, the second meal effect? It means that the next day, when you have your oatmeal in the morning, it's absorbed much more slowly. The glucose is eased into the body because you've eaten beans on a regular basis, and you have the bacteria to digest beans are part of your normal probiotic makeup in your gut. Did you follow that now? Okay, you're welcome. And now you can see what this slide does. It shows the percent of resistant starch and the resistant starch plus the fiber, and to give us a number, just a nice number. But it represents a certain degree of therapeutic power, wouldn't you say? That number, the fiber plus resistant starch, how maybe favorable the source of calories this would be for a person with heart disease or diabetes compared to eating rice and potato and oatmeal and those kind of foods. All right, so we look at those, then we can... So we could skip through this slide. Did you get that right now? Yeah. Because this slide just repeats what I just told you, right? It says, what is a Nutritarian diet? It says a Nutritarian diet is a diet that strives to be nutritionally comprehensive, avoiding potential insufficiencies, strives to be hormonally favorable, recognizes individual differences in nutrient needs requiring supplementation sometimes or sometimes not, or dietary modification to maximize disease-free mortality, which we're going to start talking about now, okay? Guys following this so far? Do I have a few minutes left? I do. Good. I only went a half hour so far. Wow. That goes fast. It seems like I talked for like 10 minutes and a half an hour went by already. Wow, amazing. Okay, so I want to present this information in a manner that people recognize that this is not controversial. People always say, oh, you're radical, and, and that there's, who do we believe? There's a million different diets out there, all with different viewpoints. And I'm saying, not really. There's all these different crazy diets out there, yes. But if we took 500 of the best nutritional scientists in the world into a room, we wouldn't see those controversies. We wouldn't see disagreements. We'd see us all generally agreeing on some simple principles. It's very hard to agree with these simple principles for anybody to, so what are these principles? Number one, vegetables, beans, seeds, nuts, fruits, whole plant foods should form the basis of their diet, right? Most of what we eat, they're good for us. They contain nutrients humans are supposed to take in. Can't disagree with that. Number two, excessive amounts of animal products cause disease. If a person on a paleo diet, thinks their diet is good, and my question is, well, do you think that any amount of animal products are okay? We could argue at what percent might be favorable or what percent might be acceptable, but you can't. But a lot of these paleo people are advising people to eat 60, 70, 80% of calories from animal products. What is this? Go back to the videotape. What does the literature show? Well, there was a major analysis done that followed 60,000 people for 18 years, just published in 2014. Just published about 6 months ago. It followed all these 60,000 people for 18 years and tracked how much animal protein they ate. And those in the highest quartile of animal protein intake had a 75% increased mortality in the 50 to 65 age range and a 400% increased risk of cancer compared to people in the lower quartile of animal protein intake. Now let's describe what that high quartile of animal protein intake was with a 400% increased risk of cancer. It was people eating 20% of calories from animal protein was the highest quartile. 20% of calories from animal protein was the highest quartile. The lowest quartile was about 8%. The highest quartile of 20% of calories from animal protein, considering animal products are mostly about 20 to 30% of calories from fat, that's about 25% of calories from animal product. That's about the same amount of animal protein most Americans eat. Did you follow that so far? So the paleo, the Atkins, the Dukan, the South Beach, all these popular diets are advocating people eat not 20%, they're advocating people 40, 50, 70% of calories from animal products. The increased risk of breast cancer could be not only cause sudden cardiac death, right? Not just talking about heart attacks, we're talking about irregular heartbeat, sudden cardiac death, atrial fibrillation, breast cancer, brain shrinkage with aging. We're talking about maybe it increases breast cancer rates by, tenfold, eightfold, sixfold. There was already fourfold increased risk of breast cancer just when you went up to 20%. I don't know how much it would be, but it's certainly not, what's the word? It's irresponsible, completely irresponsible to be advocating diets like that. And you'd be amazed at how many doctors advocate high-protein diets even. Because they're just like, lawyers, electricians, and anybody else. They believe what they read and they read these books that are popular and what people want to eat, and it's really macho and sexy to eat, the paleo diet's really popular. They're dangerous dieting. And number three, refined carbohydrates cause disease and lead to overweight and obesity and also cancer, right? So this is not controversial stuff. It's not radical. It just seems that way because Americans are on a race to see who could die first. And food is addicting. So this we discussed. Some increased risk of diabetes and cancer from white potato consumption. We know it's not from the butter and cheese they put on the potato. We know that because the scientists control for those variables, and they find that its effects, the negative effects, were mostly visible as people became overweight, which speaks to which you see with all high glycemic foods. You see their ability to promote cancer is enhanced when people become more insulin resistant or overweight. So I may not be as damaged by a potato as some person who's 50 pounds overweight would be. Same thing in the Nurses' Health Study, where we linked potatoes to diabetes. The associating potatoes and diabetes was the glycemic load, not added fats. So there are a lot of people promoting, vegan diets that are high in starchy foods like potatoes, and they're very much fearful of eating nuts and seeds and not fearful of eating potato. I'm not so fearful of eating potato if you're in good shape and eating a reasonable amount of it. I just don't want the basis of the diet to be potato, especially when you're taking people that are overweight and prone to diabetes or cancer because of their weight. This slide just slants out, graphs out the decreased risk of cancer from various foods, the green vegetables, showing, for example, the green vegetable line, that the more green vegetables you eat, the risk reduction of cancer goes to nearly 100%. I extrapolated the line. In other words, I took the line based on various studies, and 20% from this much and 40% from another much. And so I took a bunch of studies, and I extrapolated the graph and put its final point up at 100, getting to just for fun, to seeing how much of this food would you have to eat to get to 100% if 50%, if that level of food gave you 50% reduction. Did you follow what I did on the graph? So, and the purpose of the graph, and the other graphs like this, is really to show people that you don't, to show that some of the studies that show there's about a 60% reduction in breast cancer from women who eat mushrooms on a regular basis, that you only need a small amount of mushrooms. And when you went from 20% to 60%, you don't get a lot more money, bang for your buck, when you eat a whole bowl of mushrooms. In other words, 20 grams is probably all the amount you're going to get from mushrooms. You don't need to eat a lot of mushrooms. A little bit gives you those benefits. You following that? But when you take green vegetables, it's different. Because green vegetables, when people keep eating more amounts, you get more protection and more protection. You understanding this? So the red line is, of course, is non-starchy vegetables like tomatoes and onion and then green vegetables, and those foods really have powerful effects as well. And this is just, we talked about this, showing those foods that I call fast foods versus slow foods. I already discussed the rate at which foods enter the bloodstream affects the release of fat storage hormones and angiogenesis promoters. And I call fast food not only the food that we get in a fast food restaurant, but also foods that are digested and absorbed fast. You don't see a bottle of oil growing on a tree, because when you eat the original food the oil came from, it doesn't have the same biological effects. The oils and fats are bound to sterols, stanols, and fibers, and they're absorbed into the bloodstream slowly, as opposed to being absorbed into the bloodstream rapidly. They're different foods. A walnut is not the same thing as a walnut oil. Sesame seeds not the same thing as sesame oil. They took this out of my PBS show too. I was going, it's fun filming a show because all the things you like, they cut out, all the things, it's kind of but interesting. So I have this table, I can tell it to you now just because I liked it. Oh, they have this table like this, and I'm going to say to the audience, and by the way, I got this audience of 700 people in the show, of all people that had like, the whole audience had either lost 50 to 150 pounds. Had a whole 600 people lost more than 50 to 100 pounds and kept it off in the audience. But they wouldn't let me communicate with the audience. They wouldn't let me ask them questions. They wouldn't let me say, stand up if you lost 50 pounds, kept it off for a year. Stand up if you kept your weight off for 2 years. I couldn't do that. That's why, anyway. So I had a joke. I'm going to say to the audience, I'm going to hold up and you're going to tell me the food makes you thinner, makes you fat. Sesame oil, and they yell, makes you fat. Right. Sesame seeds, makes you thin. Walnuts, makes you thin. Walnut oil, makes you fat. And here I put up more oil. No, I hardly ever eat the stuff. They cut that one out too. I thought that was one of my best ones. All right, so you're getting the point here that that fast food, let me say this again, that fast food and rapidly absorbed food is not just it's linked to food addiction. It sets off this rush of calories into the bloodstream, so it's such a huge bolus. Sets off dopamine release in the brain as if you had a snort of cocaine or shot yourself with heroin. It makes people go after that heightened pleasure. They're thinking about that, waking up for that donut. They're thinking about their ice cream for dessert. They can't get it out of their mind. They're sucked into a vortex of death, of disease. It's addictive stuff because it's rapidly absorbed into the bloodstream. Right, this stuff. And it's linked to poor performance, lack of intellectual development, aggressiveness, and depression. Let me say that one more time. There's a dose-dependent link between fast food consumption and commercial baked goods with depression. Dose-dependent. And it's very important because we have a population suffering with mental disorders and depression and apathy and lack of interest. And they're addicted to a diet. They can't change their habits because of a vicious cycle of addiction and apathy. So I always talk about beans a lot. And one of the reasons I talk about beans a lot is because also the paleo people are telling people not to eat beans because it wasn't a food of the early, I guess, prehistoric man or something. Yeah, I know that's a theory. It's okay to have theories, but then we got to look at the evidence from the science and see if the theory holds up to water, holds up to scrutiny, and it doesn't, because the more beans people eat, the longer they live. And beans actually have, besides inositol pentachous phosphate, that has to be, 26 letters long. Has to be healthy if it's 26 letters long. Must be good for you. I always say that, 2 such beans twice a week, 50% reduction in colon cancer from just 2 servings of peas of beans a week. God, imagine if you had beans every day. No more friends left, but less cancer. But here's the thing. I don't know if I have it on the next slide. I do have it. I must have it. I talked about the propionate from the bacteria. It's the phytic acid in beans. What people say it binds iron or zinc. It's an anti-nutrient. No, it's going to bind the iron radical from the meat. It's going to prevent the hydroxy radical. It lowers the inflammation in the gut. It's beneficial, and the phytic acid gets absorbed and actually adheres to the cell's wall of dysplastic and abnormal cells, marking them for removal by the natural killer T cells. It increases immunorecognition of abnormal cells. Did you follow that? It's a positive thing, not a negative thing. Inhibits cancer cell migration and invasion, and we're saying here that it actually, if you were going to eat some meat, if you pull the beans out of the diet, it makes the meat more toxic. The beans actually give you some protection when you have a little meat in your diet. If you're going to make a burger, then make the burger with beans and oats and mushrooms and onions, put an ounce of meat in there per burger to give it a meat flavor, but put all that other stuff in it. Tell people to eat all meat and remove all the carbohydrate, and remove the beans. You've increased the risk of, one of the risks of meat isn't just the fact that it's high in fat, it's the animal protein. It's not just the animal protein. It's the bacteria produced from all that meat leads to certain TMAO, that increases intravascular inflammation and deposition of atherosclerosis. It's also the iron from the meat. The excess iron that we get absorbed increases the risk of intravascular inflammation, interferes with intravascular elasticity. And the beans have some effect to bind. The phytic acid binds some of that iron, lessening the negative effect of the meat. Did you follow that? So we have good science, and I'm saying what I'm trying to teach people and demonstrate is that nutritional science is interesting. It's fun. It's therapeutically applicable. We should be learning it more in school and not ignoring it. And the medical profession hasn't done such a great job in utilizing it and have it permeate. Every doctor should be an expert in nutrition. So, And so whole grains versus beans. So when people switched from white flour to whole grains, they saw improvement in cardiovascular and diabetes parameters. But when they switched from whole grains to beans, they got significant further improvements. So the point is if you're getting this, following that? So we want to get more fiber, lower glycemic loads, the hemoglobin A1C. So what if you take these principles and you apply them with more greens, more beans, more nuts and seeds? Well, then you see a dramatic lowering of the glycemic load and diabetic and cardiovascular parameters. And that's what some of the work I've done has shown. And I've seen more than probably 20,000 patients in the last 25 years. I wish I could show you a lot of these. Well, I could show you a few of the cases. But before I do that, let me go into the seeds and nuts thing. Because just like beans, just like walnuts versus walnut oil, just like beans versus bread, we're talking here when you eat the whole nut or seed, you have beneficial biologic effects because all the fat calories don't get absorbed into the body because the sterols and stanols act like a fat sponge which draw fat out of the body into the stool. Not only does eating nuts and seeds increase stool fat, but the fat found in the toilet bowl isn't the fat that was in the nuts and seeds to begin with. Think about this for a minute, because you have intrahepatic circulation of fat. So the body has the ability to suck out saturated fats and LDL cholesterol and put it in the stool and put some of that gooder fat, the health gooder, put some of the fat, the other monounsaturated and polyunsaturated in the body in place of saturated fats. There's a fat exchange going on here when you remove some of those fat calories from nuts and seeds. They're beneficial and they make people, and they also increase lifespan because they increase the absorption of phytochemicals from other foods that are not the nuts and seeds. When you're eating a salad, that's rich in isothiocyanates and organosulfate compounds from onions and green vegetables, and you're chewing it, you're going to get more absorption when you eat some nuts and seeds in the same meal versus having the salad dry with a low-fat dressing or a non-fat dressing. So nuts and seeds, in many different studies, I just took 100 different studies of nuts and seeds, and I sent them to Dean Ornish. 100 studies I collected to show him that there's not 1 or 2 or 3, but 100 studies. Not one study showing a negative effect, and all one of the 100 have shown a positive effect on lowering cardiovascular parameters, increasing lifespan, lower the risk of sudden cardiac death. There's no legitimate reason to be telling a person with heart disease they're afraid to put a walnut on a salad. That's craziness. You can have a theory, but let's test the theory and see if it holds up to science, and it doesn't hold up. Nuts and seeds lower cholesterol, and they increase intravascular elasticity. That's the marker of, of course, you know what pulse pressure is, right? The difference between the diastolic and the systolic number, what's wrong with blood pressure medications? What's wrong with blood pressure medications? Why don't they? Well, really what's wrong with them is because as we age and we get more we lose intravascular elasticity, and we need more and more medication to lower the diastolic blood pressure, it pushes, excuse me, I said that wrong. We need more and more medication to lower the systolic blood pressure. It also lowers the diastolic blood pressure to levels that are unfavorable. Because during diastole, when a healthy blood vessel should contract, keeping the pressure elevated so the coronary vessels can refill during diastole. The ventricles don't just refill during diastole, the coronary vessels fill during diastole. If diastole drops too low, you don't get good coronary filling of the coronary vessels, and you lead to more irregular heartbeats and sudden cardiac death. When you eat a Nutritarian diet, you lower blood pressure radically, making people will faint on the floor if their medications aren't lowered. They lose weight, they're increasing intravascular elasticity without the negative effects of medication, besides the fact that calcium channel blockers increase risk of breast cancer by double the risk of breast cancer, and ACE inhibitors increase kidney cancer, and beta blockers and increase the risk of diabetes, and as the statin drugs. And you pay a price for using a chemical methodology for trying to control symptoms. The best thing to do if people would not need those things. They always say to people, and we're talking about, a naturopath or an herbalist or getting stuff in your blood in the health food store to lower your blood pressure, or to make you go to sleep, or to wake you up, or to make you pee more, make you pee less. And I always say that we learned in the first year of medical school, maybe the first week of medical school, that the efficacy of a pharmacologic substance is proportional to its toxicity, right? Natural or not, we have to live in a manner to avoid the need for medicinal substances as much as we can. That's what we learned in the first month of medical school. They kept saying over and over again, you want to teach your patients to live in a manner to avoid the need for pharmacologic substances. We want to, right? But then we go on through our career and we think that's too hard, and we just give people what they want to take. We just figure, people aren't going to. It's funny because I went back to Penn and I said to them, I want to do because the eye doctors there in the Shea Eye Institute was noticing my patients come in and they had to cancel their surgeries, their laser surgeries, because their diabetic retinopathy went away, their macular degeneration reversed itself, and they were so excited. And some of these guys were my professors when I went to medical school, were still there working at the school. So they were brought, it was really great. So they put together a $1.5 million grant for the NIH, to do a study this way. So it was really exciting working with people. So I went to the diabetic department, and their position was like, we know all this stuff already, but nobody listens to us. We tried it, and we can't get people to do it. I never wanted it. It was like, but don't you understand that speaks to your skills as a teacher, as a motivator, what your training was in. I've been practicing and refining and improving the skills of convincing and how to get people to do it and to be unaddicted. So you can't just give up because people think it's hard to do. Did you follow that? One of the leading nutritional researchers in the world, Dr. David Jensen from Toronto, which I'm friendly with now, he was once speaking and he said, he did a study testing a Nutritarian diet in 2001. That was 13 years ago. He tested it in the medical journal Metabolism, and he showed that it lowered LDL cholesterol 33%, which was more powerful than most statin drugs in practice, and it did so with other beneficial oxidative effects like LDL particle size, oxidation. It doesn't just lower cholesterol. It's much better than just lowering cholesterol. You follow me? Other beneficial effects besides lowering cholesterol. But he said that only 20% of people were willing to stay on the diet long term. So I'm saying, that's the figure that you found in your studies. That's good, but doesn't mean that has to be the figure forever. Like maybe we could improve our skills at educating and motivating and all this stuff to teach people. It doesn't have to be a fixed figure of 20. He was acting like it was a fixed figure of 20%. You follow that? Anyway, so going on to, let's keep moving along before I run out of time here. So nuts and seeds reduce the risk of coronary events, and the most fascinating and interesting element of these studies, including the nurse's health study, the physician's health study, big studies that are very well known, gone on for many, many years, the most was that they dramatically decrease the risk of sudden cardiac death. In other words, sudden cardiac death, which is not the same as a heart attack. It could happen in a heart attack, but it's usually we're talking about getting into an irregular heartbeat that can kill a person, was decreased by more than 60%. And in the Seventh-day Adventist, benefits were seen in vegans as well as meat eaters. And nuts and seeds the consumption of nuts and seeds show a dramatic reduction in all-cause mortality, and all-cause mortality means not just heart disease, but cancer as well, because those are the leading causes of mortality. To take nuts and seeds out of a diet is foolish. Here's the Seventh-day Adventist study, which showed that the average Seventh-day Adventist who lives in Loma Linda, California, lived on the average 13 years longer than the average male Caucasian, right? They were comparing male Caucasians to male Caucasians, 13 years lifespan. But if we look at all the parameters, and the ones that lived the longest were the vegans who ate nuts and seeds, the non-vegans, the Seventh-day Adventist non-vegans, were not eating a lot of animal products. The religion advocates people reduce animal products or eliminate them totally, and some have very little animal products and some have none. But the vegans who did not eat nuts and seeds did not live as long as the non-vegans who ate nuts and seeds. Did you follow that one? And I cut and pasted it from that study, which showed actually some fascinating findings. Look at the differential on nuts from eating nuts to not, an age of 79 to 87, compared to the differential on vegetarian status versus non-vegetarian status. You following? You see the slide where past smoking, BMI, nuts, exercise, So we're talking about a very differentiating variable, whether you ate nuts and seeds or not, leading to a year of life difference. And the nuts and seeds that I want people to pay attention to intentionally eat are those that are high in lignans. We talked about flax seeds and chia seeds and sesame seeds. And those that are high in omega-3 fatty acids, particularly ALA, alpha-linolenic acid, that is walnuts, hemp seeds, chia seeds, and flax seeds, are very high in both. You can add sesame seeds in that mix, but sesame seeds are not high in omega-3. They're just high, they just have lignans in it, but they don't have as much lignans as flax and chia. So that's why I didn't put them up there. So we want to have some of these high omega-3. Now, if you're taking some walnuts and flax seeds, which have omega-3 in them, and the body can convert some of that omega-3 into long-chain omega-3, EPA and DHA, commonly known as fish oil, then why should we have to take any supplements of EPA and DHA? Won't we just eat more walnuts or take more flaxseed or flaxseed oil? Wouldn't the body have the ability to convert enough EPA and DHA? What do you think the answer to that question is? What do you guys think? The answer is it varies tremendously from person to person. There's a tremendous genetic variable. Let's look at some of the data here. Because, let's skip through this. It just shows that it's a walnut study that showed how beneficial walnuts were at increasing vessel elasticity and endothelial function. I'm just drumming this home that when you put a person on a vegan diet to reverse heart disease, you don't want to take away all the nuts or get a person afraid to eat a walnut. It has a beneficial effect. So a Nutritarian, I'll get back to the other point in a minute. So this slide, we'll just go in order here for a minute. This slide shows you what a Nutritarian diet, in practice, a lot of vegetables, fruits, beans, nuts, oil is used sparingly because it's a fast food. And of course, we want to save the fats to eat more nuts and seeds, not have more oil. And oil is 120 calories a tablespoon. That may have worked okay if you're in the 14th century working behind a plow 8 hours a day with an oxen. But if you're sitting on your can behind a computer all day long, how are you going to burn those extra 400 to 600 calories of fat Americans are taking in the form of oil? And here's a study which I did of over 700 participants which was really the study where I'm discussing the toxic hunger, where people switch to stop eating the American food and they go to a healthy diet and they feel headachy and weak and fatigued and stomach cramping and they feel ill. They can't stop eating, and they have to keep eating unhealthfully, and they have to keep eating between meals and all because they think they're hungry. They don't recognize that they're driven to eat too frequently and too much, because when you're in the catabolic phase of the digestive cycle, when you're in that phase where you're not digesting calories and you're just living off of the calories stored in glycogen, that's when the body is in a heightened detox phase. That's when your liver or kidney can devote itself towards repair and removal of waste products. And when that happens, you feel like crap when you're unhealthy. And because the detox is halted by eating again, people keep eating all day long. They're on one constant meal because the minute they stop digesting, they start to feel ill and they got to keep eating again. They got to keep their body digesting calories all the time. So they have to become overweight. And this study showed that if I give people enough high nutrient foods, that those sensations disappear. Eating healthy makes people no longer need to eat all the time. They have a different perception of hunger, and they don't require or desire as many calories. You can't tell a person to eat less. It's like telling them to breathe less oxygen. Instead of breathing at 14 breaths a minute, breathe at 6. Well, you'll be gasping for air in a couple of minutes because you don't feel well if you do that, and you can't feel well cutting back your calories unless you focus on nutritional quality. Because there's just too much drive, too much addictive drive to overeat when you're eating poor food. So here's a study we did on we followed diabetic patients, and here's the thing. They all became non-diabetic, all of them. All of them became non-diabetic. One of the patients was still on glucophage, only because the only one that was on glucophage was because his doctor didn't want to take him off the glucophage. But his blood sugar was below 100, and I would have taken him off if he was my patient. That would have meant all the patients would have been off their medications. So they reduced their BMI. Every one of them dropped their high triglycerides more than 100 points. The hypertensives saw blood pressure reduction. The systolic mean went from 148 to 121 with a 67% reduction in medication, blood pressure medications. So here's some of the data, and you can see the BMI drop and the LDL cholesterol. And of course, we want people to avoid medications that cause weight gain, obviously, and that's why, you guys know the Accord study. They had people who had better medical care and better management by diabetic nurse practitioners, and now we had them having increased risk mortality and increased morbidity because they were lowering their glucose with more medications, because the medications make you gain weight and make you more diabetic. And the medications take the beta cells in the pancreas that are failing, struggling to produce too much insulin, because the average diabetic is producing 5 times as much insulin as a slim, healthy person without diabetes. So I'm producing X amount of insulin. And here's a person who weighs 80 pounds more who's producing 5x insulin. Did you get that? So now that 5x insulin isn't enough insulin because their glucose is too elevated. So we give them more insulin. Worse, we give them these medications that cause the beta cells in the pancreas to work harder to produce more insulin, which causes them to fail faster. In other words, the reason you go to the emergency room with your first heart attack or your first event is because insulin is atherosclerotogenic. Insulin promotes cellular proliferation. It promotes atherosclerosis, promotes weight gain. And when you're in the pre-diabetic phases, you have high levels of insulin accelerating atherosclerosis. And then your first glucose starts to rise because the failing beta cells in the pancreas from being so overworked no longer produce 5 times as much insulin as a normal person can produce. They only produce 4 times as much. But it's not enough, and the glucose levels start to rise, so we give them more drugs that make the beta cells work harder. They're going to poop out even faster. The Accord study was stopped because the results showed intensive treatment of diabetes led to more problems. And I sometimes will come across medical studies or medical groups discussing it. They don't even understand why this happens. They're confused about why this occurs. The point is, lowering the blood pressure with medications is not going to be as stroke reducing and lifespan promoting as lowering the blood pressure without medications, with nutrition. And lowering the glucose with medications isn't going to have the same beneficial effects as lowering the glucose with change in diet and exercise. You can't just look at the number. That's just this one endpoint. You understand what I'm saying? Here's a guy. Oh, I got to some cases now. Let me see how much time I have left. It's now, I have till 5. I got almost 12 minutes left. I'm doing okay. Oh, except I wanted to end early so we can do questions and answers, but I'm almost done. We'll try to get this. I'll just speak a little faster. You can always play it back, you know. Here's a guy who came to me in 1994 with triple vessel disease. He couldn't even walk a couple of block or so with chest pains. He had a stress test, which was positive. His cardiologist said he needed urgent bypass, urgent angioplasty. I said, you know, it's not urgent. You're not unstable. What if we just give me a couple of months to see if I can get you feeling better? To go back to the cardiologist and see what he says, you know. So he gave me a couple of months, and he lost, you know, a couple of maybe 30 pounds. Within 3 months, they couldn't detect any ischemic changes on his repeat stress test. At the end of that first year, he lost 60 pounds. You could see he went from, within 3 medications, he was on no blood pressure medications with a normal blood pressure in one with the first year. So he never had the heart surgery. Never had the heart surgery. But this is now 20 years later. Now he's 93 years old. He's no longer 72 years old. He never had any heart problems since then. He's on his roof chopping wood and working in his backyard, you know. The moral of the story is that people think that atherosclerosis and high blood pressure, and we think it's the process of aging. And I'm showing these people that actually, as they got older, his native blood pressure, in other words, his unmedicated blood pressure, actually continued to improve and get lower in the second and third year on the diet program. Whereas the first year, he didn't need medication, it was still running the 130s maybe, and the second year, third year, it was running 120s. Now you got blood pressure that's like a little kid. And you know, we see that in studies on population studies, on primitive populations from different areas of the world with the most elderly people in the population. The most elders don't have high blood pressure if they didn't salt their food and, you know, if they lived in that natural environment. But people say, oh, you know, I'm not salt responsive. But don't you notice how you take people's blood pressure and it's always low, and then some year they come in, you know, 5 years later and it's high. They say, that's funny, my whole life I was told it was so low, and now you're telling me it's high? Well, yes. You thought, you know, if you keep eating the high salt diet all those years, like everybody else, well, don't forget, 94% of Americans over the age of 65 are taking medication for their heart or high blood pressure. If more than 90% of Americans develop high blood pressure, it's most likely going to happen to you too. Just because you don't have high blood pressure now doesn't mean it's not going to eventually happen unless you live a healthy life now. Don't wait till it happens, because once your sympathetic tone flips in the brain, it's then cutting the salt out of your diet isn't going to have the same effectiveness. Let's do it now before you develop the high blood pressure. And here's a woman, Julia, incredible story. Can you imagine 3 heart attacks in 3 months? I didn't know that in my residency, I used to remember that a person has a 3rd heart attack in that year, usually they're dead, right? They die with a 3rd heart attack in that year. She still lived. She had to come in a wheelchair, though, to my office. She couldn't walk without having chest pain. She couldn't even get up. She had 5 angioplasties. I didn't know anybody who had 5 angioplasties. Couldn't really believe it. 10 medications. Now she's 10 years later, I went to her son's wedding. I danced with her at a wedding. She says, I shop, I cook, I garden, I do everything I couldn't do for more than 10 years of my life. I look healthy. It's good health from within. It's wonderful. I'm having a love affair with not with Dr. Fuhrman. I'm giving this lecture in Tampa, Florida. Reminds me. I'm giving this lecture in Tampa, Florida with a group of physicians, like 600 doctors, right? And one of the doctors comes up to the aisle and just puts his hand up in the air and starts yelling at me, "You got my wife pregnant!" I go, huh? What are you talking about? He goes, well, we've been married for 6 years, been trying to have a baby, and when she saw your show on PBS, we changed the whole family, we changed our diet, and now look at her, she's pregnant. So here's Julia, and here's Ronnie, lost 140 pounds in 12 months. He lost more than 140 pounds because his bathroom scale only went up to 300 pounds. He was over 300 pounds. But he wasn't trying to lose weight fast. He was just following my instructions. I never met Ronnie. He was following my instructions in the member center at drfuhrman.com. I was communicating him through the forums. You know, those forums you communicate on blogs. I was telling him what to do. He read the books. I've talked to him on the phone a few times since then. This is like maybe 5 years ago. So look at some of his parameters. His blood pressure on 2 medications couldn't even come down. He had, oh, by the way, he had bypass surgery first, and then he had angioplasty after bypass surgery, right? And then within 3 months of having angioplasty, he gets restenosis, and they tell him they can't do anything for him anymore because he already had bypass. So they sent him home essentially to die. He couldn't. So he Googles reverse heart disease or something, finds me, but he's doing great. This is like 6 years ago. He has a waist of 332. He's dropped all his weight. He got back in great health again. His LDL cholesterol is 75 with no medication, and he's well. I've seen so many cases like this. Can go over one case after another. Here's a guy at the top. Oh, this is an interesting case. Maybe just quickly tell you this one case. So I'm giving this lecture in Fort Wayne, Indiana, and this guy's sitting in the front row. The person who set up the lecture lost 120 pounds, and she wanted me to come to her church and speak because she looks great now and she used to be obese. And she's kept the weight up for more than 10 years. And her husband was right there in the front row, Kurt. So, hey, great to meet you, Kurt. How you doing? And his wife started telling me he wasn't doing that well. And he says, well, I was doing okay. I had to stop running or exercising too much because I was getting chest pain, pressure on my chest with exercise. And so I curtailed my activity now. But now, so I can only walk. But unfortunately, the last couple of days, I'm feeling pressure right here, sitting even at rest. So I'm giving a lecture, and he's having either a heart attack or unstable angina at rest, right? So I say, well, you can't really stay to hear me give the lecture then. You got to go to the hospital, because unstable angina is a medical emergency. The story you're describing is that over the past 6 months, you've gone to mild angina, to more severe angina, to stable. Now you're unstable, and you can't just ignore it. So he essentially said to me, I'd rather die than go to the hospital. And tell me what to do. I said, well, this is not emergency treatment. It takes time, to work. With the process, you could be dead before it works. So anyway, so what happened to him is that within, he was able to walk. His resting pain went away in a few days, following the diet, a few days. His walking pain went away in a few weeks. Eventually he loses 30 pounds in the first 3 months. His blood pressure drops to normal in the first week. Within 8 weeks, he can jog with no symptoms. In 1 year, his blood pressure is great. He has no symptoms. He's fine. He can do anything he wants. He can sprint. The point I'm making here is that I have another case that just came to me recently. He had 100% occlusion, 100% occlusion in his left anterior descending artery, told he needed urgent emergency surgery, and refused to have the surgery. So, so in any case, he got well, totally well. He's doing great. He dropped 70 pounds, he's slim, if they're really motivated, it works. Even in these really, really severe cases. Here's a guy who has an 80% occluded carotid. 1 year carotid ultrasound, it's 40% occluded in 1 year. In the second year carotid ultrasound, they couldn't find anything. They couldn't find any plaque at all in his carotid arteries after 2 years. We're talking about a lot of reversal here,
This includes exercise though, right? Or is this just the diet?
Well, don't forget that a lot of these patients are too sick to do much exercise. Yes, it includes exercise as their health improves sufficiently so they can tolerate exercise. And when you get in great health, you want to exercise and be active. But obviously, you can't start with exercise if you're not healthy enough to exercise, right? And of course, we can go on, but I think we got to move on here. Oh yeah, I got to talk about this briefly. Let me just go through this briefly. We're talking about depression. I think it's important to go over this for a minute because I want to leave you with how effective this is for depression, because how many people with even major depressive disorder can get well without drugs. Because first of all, you guys know that the melatonin peaks at about 10 o'clock at night after a couple hours after it gets dark out, and melatonin helps us sleep better and stay asleep. But its exposure to bright light in the morning that halts melatonin secretion. And if you're in a dim atmosphere, in a dim light like this, melatonin secretion can continue into daylight hours. And if melatonin secretion continues into daylight hours, then you're going to have less peaking of melatonin and secretion at night. And then you're not going to have as much serotonin production during the day because the serotonin, which is the feel-good hormone, can't be produced if you make it melatonin instead. So light therapy is very effective, not just for seasonal affective disorder, but it's effective for major depressive disorder as well. And here we're talking about the antidepressant studies show that the antidepressants are not very effective. And in a head-to-head comparison, light therapy outperforms drug therapy for major depression. But what if you combine DHA and EPA supplementation, which has been shown very effective for depression? Even in low dose, it's 40% effective, and some of these studies show that if you go to higher doses, it's 100% effective in SSRI-resistant depression. I've been exposed to many vegans who became depressed because of low levels of fatty acid conversion, whose depression was fixed by taking supplements with EPA and DHA and zinc, which that's what I'm going to discuss right now. So here we're talking about the meta-analysis are consistent that depression is commonly associated with lower levels of EPA and DHA. And a vegan diet could precipitate that in some people who genetically don't genetically convert favorable. I was going to talk about that 5-10 minutes ago, but I got into some different slides. We'll get into it now. And that because of the extra phytic acid and binding of iron and copper and zinc, there could be borderline zinc in some people as well, which could further exacerbate the tendency towards anxiety and depression. I have some of my family or some people, many patients I've seen who develop depression. When you give them the EPA and DHA, usually about 1,000 milligrams of EPA a day initially, with about 30 to 50 milligrams of zinc a day, they come out of it pretty quick. I've seen one person come out of it like within 2 days of giving within 2 weeks of the EPA, and sometimes within 2 days of giving them zinc, their anxiety gets better. And what if you add a high nutrient diet and remove the processed foods, and you give them a Nutritarian diet with all the right nutrients for the brain as well? Well, then what I'm saying to you is that the protocol I have, which involves light therapy, vegetable and fruit, this heavy, healthy diet with flax seeds or chia seeds, with walnuts, with EPA and DHA, with no processed foods, with saffron, sometimes with additional zinc, is extremely effective, not only in treating major depressive disorder, but in helping people who aren't getting response to their drugs. What does the conventional psychiatrist do? Is they put them on antipsychotic medications, right? They try to give them more powerful, more dangerous drugs instead of just figuring out the nutrition. And I don't want to conclude with that DHA and depression, that DHA, and dementia, that's supposed to say dementia. I couldn't change the slide. So insufficiency, increased risk of dementia, not depression on that slide. You follow that? Brain shrinkage with aging is proportional to lower levels of people with lower levels below 4 and the omega-3 index have developed smaller brains with aging. If we're going to be making people or helping people live longer into their 80s and 90s, we have to protect their brains in doing so. And this is the point I wanted to make earlier when I asked the question whether vegans convert enough of ALA into EPA and DHA, and somebody said no and somebody said yes. And my answer was, you're both right and you're both wrong, because the studies that we just did on 160 vegans, on about 166 vegans, showed that the ratio of differences was amazing across the board, where some people produced plenty of EPA and DHA, and some people produced dangerously low levels. And here's the thing that was so fascinating. It didn't correlate with their level of ALA intake, meaning that it was caused by genetic differences in conversion enzymes. Did you follow that one? So it's a subset of vegans. It's about 27% that actually have levels, the dangerously low levels, like say below 3, that could get into depression or dementia. But you want to be aware of this because I'm claiming that the vegan community is irresponsible, is irresponsible because they want to give the impression that an unsupplemented vegan diet is the perfect diet for everybody. And we have to be cautious here and careful because some people do require certain higher levels of things that might be animal product dependent due to genetic differences. Maybe the way they ate, maybe what they were raised on, maybe they're who their parents were, whatever the reasons are. We have to be somewhat more cautious. And we can't say, well, vegetarians have less depression, therefore they don't need, we can't say, but that's not true. You can say the Mediterranean diet would be the perfect diet because they have less heart attacks, but they still have 35% of people die of heart disease. It's not there's a lot of stuff we could do better than a Mediterranean diet. Did you follow that? There's still depression, and there's still fixable. And there's still dementia, and it's still preventable. And why not have nobody get a problem if it's possible to do that? So finishing up here, here's a Women's Health Initiative memory study, which followed 1,000 women for 8 years and followed that greater brain volume and higher EPA, DHA, omega-3 index, had larger brain volume and retained their, and especially larger volume of the hippocampus, which controls thinking and emotional decision making, you know, and so I'm saying here that we have to be cautious that a vegan diet is most likely the most favorable diet for its cardiac and anti-cancer effects, but we have to be careful and not consider individual differences and make sure we feed people healthy food and also supplement intelligently, either by, because you know that B12, we should talk about B12 and vitamin D as well, that B12 differences occur between people and as they age, but also when you're taking animal products almost all day long, you're absorbing, you need less B12. When you're on a vegan diet, you need more B12 because you can only absorb about a certain percent of that B12 you're taking. And if you're absorbing that certain percent with every meal you're eating animal products, you get sufficient levels. But if you're only taking a pill or a vitamin pill once a day, you're only getting a small percent once a day. And since the body can only absorb a small percent at once, you need a higher percent because you're just taking it once a day. Did you follow that? You got that? It's a little confusing, I recognize. But just remember that, that if you're on a vegan diet, you need a little higher level. The RDI for B12 is not sufficient for a person on a vegan diet. That's what I want to leave you with. And I think finishing this up, those are some references. And vitamin D and cognition, we're out of the sun, we're indoors. We have to make sure that we have adequate vitamin D levels to prevent dementia. Vitamin D and dementia, we'll skip through this. So this is, I think, my last slide. It's saying that I don't advocate, there are a lot of well-known vegan authors and nutritional gurus who advocate that the benefit of a vegan diet is it's low fat. It says it's so low fat, and they recommend no oil and no nuts and seeds. And I'm warning against that and saying the science has advanced to the point where those viewpoints don't hold up to scientific scrutiny anymore. And I think that we have to let science direct us to more advances and make sure more people are adequately protected. And sometimes egos get in the way of saying what I've said about 10 years ago was no longer right, and I have to modify my message a little bit, and people are reticent to modify their messages.